Welcome back to Midday Kentucky, everyone. Well, for many of us, September is a time for getting back into routines and looking forward to the cooler weather just around the corner, just like me. Unfortunately, September also means that flu season is right around the corner. Well, the team at Clark Regional Medical Centre wants to ensure that we do everything we can to prevent the spread of what is becoming a very serious illness, everyone. And to help you stay healthy for the busy months ahead, Dr. Tom will be here to discuss ways you can prevent the flu. How are you, Dr. Thomas?
Doing well.
Okay. Talk to me a little bit about fall is here.
Yes.
So what is the flu? Because I know people say they get a cold and then it turns into a flu. Does it? They're two different things. Break it down for me.
Well, the flu, first of all, is a virus. And the point that I think I want to make on that is that antibiotics are not going to help that. It's not a cold. Colds are milder. Although they share similar symptoms, they are milder and may last longer. Flu can be pretty severe, and usually the worst symptoms, 2 to 3 days, significant cough, sore throat, muscle aches, fever, headaches.
That's the flu.
That's the flu.
Can I just quickly ask, what are the symptoms of a cold then?
Well, the runny nose, but much less.
Right.
You don't feel nearly as bad.
Okay.
There's a lot of interplay between the two, but the flu is a real deal.
Okay, and it is, and it's becoming more and more dangerous every year, agree?
Absolutely.
All right, this season coming up, how can we prevent getting the flu?
I think really the most, you start with the basics, and the basics are stuff that we all learned as kids. Hand washing. If you cough, cover your mouth. The use of hand sanitizers is a good thing to do. So those kind of basic things.
Can I jump in? It's not on my list, but what about vitamin C tablets or having an orange a day type of thing?
I don't think there's any proof that that really makes any difference.
Okay, interesting.
Yeah.
Interesting. Lots of fluids, keeping,
Yes.
Drinking lots of water. So let's talk about the flu vaccine, and I'm just about to have one. So at what age should you be getting them? And are there actually any common side effects when it comes time to actually having the flu injection?
Well, who should get the flu vaccine?
Yeah.
And basically, that's everybody.
Even kids?
6 months forward.
Oh, really?
Yes, and it's very important because there are certain vulnerable populations, certainly newborns, young children, over 65, which doesn't seem very old to
Well,
me,
they were always said it was for the elderly.
Yes.
That was what they say it was actually made.
But you worry about people with chronic illness, certainly asthma, lung disease, heart disease, not high blood pressure, but heart
people
disease.
with a low immune system.
That's right. Maybe people who are taking steroids long term are certainly
Hypochondriacs?
Well, everybody.
Everybody. That's what I like to hear.
Yeah.
Okay, now, this is a common myth that a lot of people say out there in the general public as well, all over the world. Can I get the flu by having the flu injection?
Well, the answer is no. And the reason is that the flu shots do not contain a live virus. So the answer is no. Now, I hear it all the time, and people will swear by that, but actually you cannot.
Okay, this is a really interesting question that a viewer wrote in when we said that you were coming in. Can I get the flu vaccine if I have an egg allergy? What?
Well, I hear this all the time. I should not, take the shot because I'm allergic to egg. But the Center for Disease Control says if you have an egg allergy, you can actually take the flu shot. That the egg allergen that's in that flu injection is very minor. Now, if you're worried about it, if you're really worried about it, get the flu vaccine at the doctor's office, maybe not at a clinic or the pharmacy where you can be monitored.
I was about to say that. Go to, I'm not saying that the pharmacies aren't professional, but go to your everyday physician.
Yeah, because they can monitor, you can stay there, and if something happens, they're better prepared.
Dr. Thomas, great advice. Look forward to seeing you again. If you want to find out more about Dr. Thomas or Clark Regional Medical Centre, there it all is up on the screen now. Give them a call as well, and there's their website. Hey, stick around, everyone. Dr. Barsha is in next, discussing, which I know I need, everyone, testosterone and testosterone testosterone therapy. Stick with us, you're watching Midday Kentucky.